Hello everyone, my name is Kelvin Raymond from Harvard University. Today we are looking at something often ignored in our anatomy labs, but it's vital in the clinic. That's our attitude. As as physiotherapists, your technical skills is the only half the battle. Your attitude is the only bridge to patient recovery. We have the ABS model. The model, this is the attitude three legs stool. We have the affective, how you feel, behavior, what you do, the cognitive, what you think. If you think a patient is difficult, the cognitive, you will feel frustrated, which is affective, and your therapy will be rushed, behavioral. So to change the outcome, you must address all three. The core characteristic. Attitude aren't just random. They are learned. We pick them from mentors and experience. Enduring once once set, they stick. Evaluative. We constantly judge if the things are good or bad. As students, we must consciously choose to evaluate our patient with curiosity and not judgment. Why? As you see here, why? Why do we have to evaluate our patient with curiosity and not judgment? So we're going to see this by the functions of attitude. Why do you have them? They are mental shortcuts. They help us to organize the world and defend our ego. But in the clinic, they act as filter. If your filter is negative, you will miss the patient's progress. Also, here's attitude in physiotherapy. Here's the reality attitude. Drive adherence. If a patient says you don't believe they can recover, they won't do their home exercise. Your attitude actually changes how perceive their own pain. So as you can see here, the attitude of a physiotherapy and a patient. The role of physiotherapy student. We have different roles here. We have empathy, professionalism, and openness. Here in professionalism, we see understanding the patient's journey. In empathy, we understand patient's journey. Professionalism, acting as a role model for the health. Openness, willingness to learn and adapt new evidence. So, attitude in conclusion, attitude is a little thing but makes a big difference. This was quoted by Winston Churchill, which it says that to wrap up, a positive professionalism attitude is your most powerful clinical tool as a physiotherapy. It transforms a patient into partner and in their own recovery. Thank you so much. These are my references, book and sources, and these are the reference image sources. Thank you. My name is Kelvin Draymond from Harvard University.